more than 8 million people each year, and more than 7 million of those deaths are the results of direct tobacco use. And around 1.2 million are the results of non-smokers being exposed to a second-hand smoke.
So, feels like quitting smoking? Don't worry, I know it's not easy. But if you click into this video, you are halfway there in your smoking quitting journey. Or else, you are someone who deeply concerned about your loved one's health.
So, how do cigarettes affect the body? Within seconds, the lining of your nose and esophagus becomes red and irritated from the chemicals and smoke. You may start to cough. Then, you start to feel itchy at the back of your mouth. The heat and tar from your cigarette even discolor your teeth, gums, and lips. Within 20 minutes, nicotine starts entering your bloodstream, increasing your heart rate and blood pressure. Your sense of smell is reduced. Your brain will release feel-good chemicals, causes mood swing and hunger. When you don't satisfy the urge, you will feel anxious and irritable. Within 8 to 48 hours, the nicotine and carbon monoxide finally begin to leave your system. The mucus that is supposed to coat and protect your lungs will begin to drain. When you do your usual exercise or physical activity, you may feel like you are out of breath. This is because smoking makes it harder for your blood to circulate, affecting your oxygen delivery. Well, that is just the effect of one puff. Can you imagine if you smoke every single day? Eventually, you may get diseases like lung cancer, heart attack, or cause premature birth, COPD, tooth loss, and many more. We know that smoking is bad for our health, but why do people still begin to smoke? The main reason that we often hear is stress. For smokers, smoking helps to numb themselves to relieve their stress. This is due to the calming effect of the nicotine in the cigarette. Nicotine stimulates the release of chemical dopamine in the brain. Dopamine is involved in triggering positive feelings, and therefore, people use cigarettes as a way of temporarily increasing their dopamine supply. Another reason why people begin to smoke is peer pressure. Peer influence is particularly strong in adolescent years, as children reduce the amount of time spent with parents and increase the amount of unsupervised time spent with peers. Peer pressure is not limited to just teenagers though. Individuals may also want to smoke to fit in within a workplace, as smokers easily create a sense of bond over a smoke. Besides that, smoking has been traditionally viewed as one of the badges of coolness among the society. Refusing an offer of cigarettes or declaring that I don't smoke may be thought as loser. Other than that, environmental factors such as parental smoking may also be one of the reasons why people begin to smoke. Studies have shown that teenagers whose parents smoke are more likely to begin smoking in their early teenagers' life. This is because when the child looks at their parents, they might feel curious about the tobacco cigarette. They will start to questions like, what does it taste like? And how does it feel like? This curiosity will eventually lead the child to begin to smoke in the early teenage stage. However, good news awaits to those who wish to stop smoking. This is because as soon as you stop smoking, your body will begin to repair itself. All smokers will experience instant physical health benefits. Within 20 minutes, your heart rate and blood pressure drops and returns to normal. After 12 hours, the carbon monoxide levels will also return to normal, and oxygen level increases within body. After 1 day of quitting smoking, the risk for coronary heart disease decreases. Besides, your taste bud and ability to smell will also improve after 2 days. After 3 days, the bronchial tube relaxes and increases the energy level. And within a month, your lung functions will also improve. Not to forget, blood circulation will also improve after 3 months. And guess what? The risk for coronary heart disease decreases by half after 1 year. Then, after 5 years, the risk for stroke will also decreases. After 10 years of quitting cigarette smoking, the risk of developing several types of cancer also decreases. And you know what? After 15 years, the risk for coronary heart disease is equivalent to a non-smoker. Surprisingly, after 20 years of quitting smoking, the risk of death from smoking-related causes including both lung disease and cancer drops to the level of a person who has never smoked in their life. Well, as you can see, the sooner you quit smoking, the greater the benefits. In addition, the changes in major parts of the body is also benefited from quitting smoking. Your brain will rewire and break the addiction cycle. Besides that, large number of nicotine receptors will return to normal. And your mouth becomes clean and teeth stops yellowing. Your lung function will also improve, and this will prevent diseases like emphysema. Besides, the risk of getting various cancer also decreases. When you stop smoking, the risk of getting diabetes also decreases. Other than that, quitting smoking can reduce the chances of erectile dysfunction. Not to forget, the immune system will become even stronger, and same goes to your muscles in the body. And hence, this will reduce the risk of bone fractures. Last but not least, quitting smoking can increase your life expectancy.
If you quit smoking, you will find out it saves a lot. First, if one pack of cigarettes costs you 18 ringgit, if you smoke one pack per day, then in a month you will spend 600 ringgit. Imagine, this can be extra pocket money if you quit smoking that you can utilize for other beneficial stuff, like picking up new hobbies to enhance your mental health, having vacations with family, and buying things that you have been wanting. Money can be saved from smoking-related accessories, including lighter and ashtrays. Smoking can cause cancers, especially lung cancer, stroke, asthma, gum disease, type 2 diabetes, and many other diseases include heart disease. Thus, by quitting smoking, besides saving the money that initially used to purchase cigarettes, the risk of getting diseases like lung infection, breast cancer, and COPD will be decreasing, meaning that less money needs to spend on medications and less healthcare burden. Besides, as smoking can cause yellowish teeth, the requirement to seek for a dentist will decrease as the health of the teeth can be improved if the smokers begin to quit smoking. Smoking can lower health insurance premium. Insurance companies may charge you extra due to the status of you being a smoker. Such charges can be up to 50% higher than those non-smokers, as insurance companies usually end up paying more for the healthcare of smokers compared to non-smokers. If you quit smoking for more than 6 months, you'll be eligible to sign up for a new insurance plan without any extra charges. According to American Lung Association, secondhand smoke contribute to productivity losses of 5.6 billion per year. Exposure to second-hand and third-hand smokes can actually increase the risk of infection and diseases like asthma and respiratory infection. For instance, kids exposed to second-hand smoke have a higher risk of otitis media, lower respiratory tract infection, and also asthma. By quitting, you manage to protect and improve their health by reducing the risk of those diseases. Smoking also causes accumulation of residual nicotine and tobacco particles on surfaces, furniture, and clothing. Stop smoking will improve family members' health status and quality of life. People who stop smoking will experience improvements in their mental health. Research studies found enormous psychological benefits in people who stop smoking. Stop smoking lowers anxiety, depression, and stress level. Besides, it improves quality of life and positive moods. Also, it can reduce doses of antipsychotic medicines. Quitting smoking is also linked to a good social health. Quit smoking able to provide smoke-free environment for your family and friends. It gives positive impacts on the health of your loved one and reduce the likelihood of the children to pick up smoking habit. You no longer have to miss out on social events where smoking is not allowed, and able to feel at ease around people who do not smoke. Quitting smoking able to stop subjecting to your family, friends, and people in your surroundings to secondhand smoke. Now, You might start thinking, what can I do to kickstart and when should I start? No worries, we are here to guide you with some ideas. It's strongly encouraged to seek help from professionals. If you wish to plan yourself, you can join MQuit, which is a program of Ministry of Health. It offers integrated services that can help you to quit smoking. It is normal to have withdrawal symptoms like difficulty sleeping, dry throat, coughing, increased appetite, anxiety, and restlessness. This is where nicotine replacement therapy could help. For information, nicotine replacement therapy can be in patches, gum, lozenges, inhaler. They ease withdrawal symptoms by maintaining body nicotine concentration above craving threshold and improve cessation outcomes. Quitting smoking is never an easy task, but we know you can do it. Don't hesitate to embark your new journey by quitting smoking. You will see immediate and amazing changes from physical health to mental health to financial benefits. Act now, regret later. Thanks for watching. We'll see you next time.